More than 40,000 people have tested positive for the coronavirus globally, resulting in more than 1,000 deaths. And tonight, the Trump administration is stepping up containment efforts. Fox News correspondent Jonathan Sari has a look at what's being done.
The deadly coronavirus outbreak keeps spreading, with a 13th confirmed case in the U.S. The patient, who was evacuated from Wuhan, China, is now hospitalized in San Diego. The first group of evacuees has been under quarantine for 14 days, but that quarantine period is now over. The CDC saying they pose no risk to the general public.
Our current strategy is really a containment one, focused on our borders and focused on intense evaluation around each confirmed case.
The Trump administration also says it's stepping up efforts to contain the virus. Secretary of State Mike Pompeo and HHS Secretary Alex Azar writing, quote, "Our task force is ensuring that our whole of government layered public health plan has the resources necessary to protect Americans." But that's not enough for some workers on the front lines of the outbreak, including airline employees who say the government is not offering them enough support.
This isn't a theoretical for aviation workers. Coronavirus has already entered our workplace and disrupted our jobs and our lives.
Meanwhile, the World Health Organization is holding a global research and innovation forum to mobilize the international response to the outbreak. Officials there pushing for more containment to stop coronavirus from becoming a global pandemic.
We're not dealing here with a super spreading event, but certainly it is always a concern when people come together and then move apart, and we have to have risk management procedures.
The WHO says it's sending additional teams to China to investigate the origins of the virus. In Atlanta, Jonathan Sari, Fox News.
A new study from the University of Michigan finds nearly a fifth of surgeries may lead to surprise bills, even when the doctor and the hospital are in network. U of M researchers looked at the insurance claims for more than 347,000 patients. The lead surgeons and the surgery locations were both in network. Despite that, more than 20% of these common procedures resulted in a surprise bill that was on average more than $2,000. The researchers say that's because the anesthesiologists and surgical assistants were often out of network. The scientists say patients should check their insurance network and ask about billing practices when they schedule an operation.